You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments, ethical processing, more profit, less stress. Chiro HD, more than an EHR, practice management simplified. The Chiro Speaking Company, attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. OmniWave, redefining comfort and acoustic wave technology. The Chiro Hustle Podcast is sponsored by Chiro Health USA, ChiroScript AI, Chiro Moguls, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. Let's hustle.
Hey guys, welcome to episode 741 of the Chiro Hustle Podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Kate Gress. And if you want to hear about her story of 27 years in practice and getting involved in real estate, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle Podcast. Today I have Kate Gress on with me, coming in from Wisconsin, and I'm out here in beautiful Grand Junction, Colorado. Just to let you guys know our big why. Why do we do what we do over here at Chiro Hustle? Well, first things first is freedom of speech. As we know, the past 5 years has been kind of murky. We know what it's like to be shadow banned and traffic throttled and censored. We'd never do that to you. Actually, everybody that's ever interviewed with us, Dr. Kate, we've aired it. So it's really cool. We believe in that thing called freedom of speech. We also believe in medical freedom and family health freedom. They're not the same things, but if you guys are looking for that, reach out to a chiropractor in your neck of the woods. I'm sure they'd be happy to help you and your family. Answer any questions you have. Philosophically speaking, we do this thing called protecting the sacred trust. If you guys don't know what that is, go to our show notes, click on the show note link, and check out Sacred Trust. It's BJ Palmer's last words. Maybe you've been practicing for 27 years like Dr. Kate, and maybe you haven't been practicing at all and you're curious about this beautiful profession. Go click on that, learn more about it. It's BJ Palmer's last written words. I guarantee you'll fall deeper in love with this beautiful profession. When we get into talking about subluxation-based chiropractic, that's something we support also. I know you shouldn't have to say these things, but they're taking it out of the colleges, as we discussed before the interview started. The schools are not teaching the kids about philosophy as much as they used to, and subluxation. So if you know a chiropractic student or a young DC that's just finished school, please share the show with them. It's very vital that we carry on the message of vitalistic chiropractic. Lastly, we believe in innate intelligence and universal intelligence. We believe that when man or woman, the physical, gets adjusted, it connects them to man or woman, the spiritual, which creates educated intelligence. And that's the opener for our show. Dr. Kate, you're episode 741. Welcome.
Hi, thank you.
So 27 years ago, tell us how you got into this profession.
Yes, it's been almost 27 years. So I got into the profession. Actually, I started in college in nursing and changed my major, I think second year in college. Decided, chiropractic sounds kind of interesting. I actually had been to a chiropractor when I was a teenager. It's not a super exciting story. I had some kink in my neck and told my mom my neck hurt. And she said, I'm going to take you to my chiropractor. And I'm like, what's a chiropractor? I have no idea. So she took me to the her chiropractor, and I got adjusted. And I'd kind of go if I had pain, when I had pain, that sort of thing. So I didn't really know what chiropractic was. But I thought, sounds interesting. I like the sciences. I like healthcare. I want to be in healthcare. I want to help people. I like to own my own business, so I could do all of those things with chiropractic. So I went to chiropractic school, and it wasn't really until I got out of chiropractic school that I think, learned what chiropractic really was. And so, yeah, I just, when I got out, I started attending a lot of conferences, seminars, just learning more, getting more of the philosophy, because where I went to school, I didn't get a lot of that. So I got a lot of that outside of school after I got out of school, and went for my pediatric certification through the ICPA. So I did that and really got into seeing more children, babies, families. And so I have a family wellness clinic now. And so, yeah, just getting into all of that, I started getting in more of the philosophy and the bigger picture of chiropractic, and started communicating that more with my patients early on in my practice. And that's how I grew a family wellness practice.
Yeah, I think it's really interesting to hear these stories. As you know, we met down at Parker, Miami, and I was telling you about like the work that we do over here. And I feel like through osmosis, I have a chiropractic brain now, as much as I talk about the profession. But I guess not a critical question, but an interesting question. I'm curious, why do you feel that the schools have started to step away from, even back 27 years ago, giving a good fundamental foundation for philosophy? Like, doesn't that matter to, like, I mean, you said you had to go out after school and go get those tools. Why are they like not equipping the students with that knowledge?
Yeah, that's interesting. I don't really know for sure, but what's interesting, this is kind of an interesting story. When I was in chiropractic school, I remember being in class, and we were having a big discussion, the whole class and the professor. And one of my classmates came back, and he was out doing some internship or doing something, and he was talking about subluxation. And we are all kind of like, what are you talking about? Like, the only thing that we do is correct the subluxation. And we're kind of like, why he's being a whack job? Because that was not what we were being taught. And, now it's like, now I understand. But back then we were all like, oh, that's weird.
Well, because I just believe that they don't give the fundamentals to educate on the major premise of what chiropractic is. And that's the part where when I go out and I speak at different organizations and schools, like I really have to like put up slides and say, this is what subluxation means. This is what innate intelligence means. Even at like state associations, when I go speak at huge conferences, I'm like, this is the definition of innate intelligence. This is the definition of universal intelligence. This is the definition of educated intelligence. If you guys want to learn more about this, go listen to our show. And then I meet people in public.
Yeah, which
and
is sad.
Like, but they're like, you're the philosophy guy. I'm like, no, I'm not the philosophy guy. I just understand philosophy, and it's something that I talk about because I don't want it to like get forgotten. So I think that I want everybody to be the philosophy guy and gal.
Right. Yeah. I mean, it is kind of sad that you have to, when you're out talking to chiropractors, but, to teach them that. But if they're not learning in school, then great. You're teaching them that.
Well, that's why I implore at the opener, share the show with somebody, a student, young graduate, because this is how I'll tell you, I go around all over the country. I meet people that have been listening to our show for 7 years, and they're like, thank you. I didn't know what chiropractic was until I started listening to your show all the time. And then now I get a chance to listen to doctors talk about this profession, and now I understand the profession better. So thank you for helping me get through it. They're like, the school taught me how to pass boards, but they didn't equip me on how to adjust really strong. And they didn't really do too much for me except for give me the fundamentals of getting an education. So I think it's important that we do share the show. So if you guys are watching this and you guys watch it anytime, just share it with somebody. Back to the student thing. What advice would you give to a student today?
I would tell them, if they need to go outside of their school and the classroom, absorb everything you can, learn that philosophy, and then really learn how to communicate. So that's the big thing. You can be a great adjuster, but if you can't communicate, if you don't have the philosophy and you can't communicate that and educate your patients, then you're not going to have a great practice.
Yeah. Communication. I can't believe it. When I first got into working in a clinic 16 years ago, the doctor I was working with said him and the other doc were going to go to a class so they could learn communication. And I was just like befuddled. I'm like, you're telling me you guys went to graduate school, you have a master's in business, and you guys got to go to a seminar for somebody to tell you how to talk to somebody? I was like, this is bananas to me.
But it's huge though. I mean, they have to learn, how to communicate that. I'm sure they know it. Once they do know it, once they have that philosophy, how are they going to express that to their patients? I think some of them do struggle with that.
So what would you say is the best route for somebody to learn better communication skills?
Well, I guess I just say whatever you need to do, whether it's listening to podcasts, shadowing other doctors that are successful. I think that might be huge. Just going and seeing how those doctors are communicating with their patients, how they're telling the story. And, everyone has a different communication style, but, they're going to have to kind of find their own and what's going to be the best and resonate with them and their patients.
Well, I'll give a few takeaways to people if I can. I would say join a young professionals networking group and go mingle with people and tell them about what you do. Join a young professionals group and a networking group where you can get up and give like a 5-minute talk once a quarter about your company and your business, and join the chamber and meet with people and talk about it there. I think the networking groups really pushes people into that, like, I have to do a little talk thing and I have to like interact with other business professionals, and dang, I better get my act together because that's important. So right. I think that's my pathway for if a young student wanted to learn how to be a better communicator would be throw yourself into the fire and go tell the chiropractic story.
Yep. Yeah, I think that's great. And just get comfortable with being uncomfortable.
Mm-hmm. The chiropractic profession, been in it 27 years. Where do you see this profession going?
I think we're really, the direction it's already has been heading is wellness, right? Health and wellness as opposed to treating the symptoms. But I think that's kind of where we're heading. I think people want that, now, and they're going to want it even more in the future. They don't want to take a pill or a potion or a lotion to fix their symptoms. They really want true health and wellness. And so I think we are just poised for being that go-to. So I think that's where we're at.
I go out and do screens like I was just telling you. People just don't know it's called chiropractic. They all know that they need somebody. They all know that they need a system like chiropractic, but they're like, why would I go see the chiropractor? I don't have a neck pain. I don't have back pain. And right. They just don't understand that it's a nervous system and brain system that actually gets the impact of the adjustment, and the pain starts to feel a little bit better too.
Mm-hmm. Right. And that just goes back to the education and the communication. We just have to be doing that and continuing to educate our patients on really what wellness is, and not waiting for the symptoms, and explaining, like you said, the health of the nervous system.
So I would say maybe 10% to 12% to 15% of people in America are actually under chiropractic care. How do we get to the other 90-some percent?
Yeah, I've heard it's even less than 10%, but I'm not really sure.
How do we get to that other group?
I think it's just boots on the ground. We all have to be doing our part, and it starts in our offices, but then also outside of our offices, like you said, screenings. I know there's so many different ways to market your practice, right? Social media, networking groups, whatever it might be. So I think that we just have to all be getting out there. And, I think when I was early on in practice, I think I thought to myself, oh, I'm going to do these screenings, these events, and someday I won't have to do that. No, I still do that. We still do that. We still do the screenings and the events and take every opportunity we can to get out there in our community and teach people about chiropractic. But I think that has to come from all the offices, and we have to all be communicating that and be on the same page.
Yeah, I think the whole idea of competition in chiropractic is a bit blasé to me, specifically because we're only seeing 10%. Like that means that there's a 90% grab of opportunity out there that nobody should ever feel like they're like fighting over the same patients.
Right. Yeah. There's no reason for that at all.
Mentors, who helped you develop your philosophy?
I think I had a lot of mentors. I really believed in coaching. I had a coach from the beginning, and different coaching groups, different mastermind groups. One of my biggest mentors is actually my husband, who I started, he was my consultant, my coach early on. And he's still, he helps me get my head back in the game when I need it. So.
You've made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Peach State Payments. Ethical processing, more profit, less stress. Chiro HD, more than an EHR. Practice management simplified. The Chiro Speaking Company. Attract, educate, and convert. Chiro Spring, cloud-based, user-friendly software with all the essential features chiropractors need. OmniWave, redefining comfort and acoustic wave technology. The Chiro Hustle Podcast is sponsored by Chiro Health USA, ChiroScript AI, Chiro Moguls, Pure Chiro Notes, 5-Star Forge, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, and the IFCO. Let's hustle. Yeah, I think it's important to have people close to us that can help us stay on track. And, I think that the greats of chiropractic had a lot of wisdom and a lot of potential for people to learn from, but also people the closest to us that believe in what we believe in. It's very important too. Divided house will never stand.
Yeah, true.
And I know you got other business ventures going on right now too. I mean, you develop and diversified. That's one of the things I want to get clear with people too, as they watch our show, is chiropractors can have other interests in the world. Okay. Chiropractors can coach teams. They can have hobbies and interests and do other things besides adjust full time. And I think that it's important for people to diversify their life as they mature and as they figure out the way of their world. And you've gotten to real estate. What made you decide that was a good pathway for you?
I started in real estate early into practice, a few years into practice. I was looking for a space for my office and decided to buy some property. And I ended up tearing down the building that was there. I was going to remodel it, but ended up just tearing it down and building a smaller professional building with some rental space. And so that was kind of the start. And then over time, I got into some single family homes, some smaller multifamily. And I just thought, I didn't want to rely on one thing for my retirement. I didn't want to just rely on, my practice, because I didn't know. So I thought, I'm going to do real estate too. And just like I diversify, I'm in the stock market, IRAs, and, all of that. So real estate was one of the things I wanted to do as well. So then I got into bigger multifamily syndications.
And I think that this is a really good learning moment for people. When we go out there and get into something that's a passion, you're actually developing like a future for other people with that opportunity of a place to live, a place to run a business, a sanctuary for your practice. And that's the thing about owning land and owning opportunity and being a real estate investor is you're creating a life for other people through your vision. And that's a really beautiful thing that a lot of people don't see it that way. But when you actually can help people find a place to live or find a place to run their business out of, and you can support them and they don't have to do all the red tape and all the legality stuff and all the tax stuff. Like, what a blessing to the people that you help.
Right. And right now there's a huge housing shortage in this country. So it's needed. So that's a big part of what we do as multifamily apartment complexes.
So from practice to passive profits, how does this link into our audience today?
So what we do is like I said, syndications. So for anyone who doesn't really know what that is, what we do is we partner, we bring in passive investors to partner with us and buy up multifamily apartment complexes. And we partner with them and share in the profits. And so it's really ideal investing for busy professionals, chiropractors, so that they can keep doing what they want to do and what they love to do, adjusting patients. Being in their practice, and they don't have to worry about, if they want to own real estate, they don't have to worry about dealing with the tenants and the toilets and having all those headaches and the calls at midnight. So we handle all of that. My team handles all of that. We're the active part of the team, and from finding the markets, sourcing the deals, getting the financing, dealing with the property managers, all of that. So we do all that so that our investors can just, like I said, do what they want to do and continue to practice if that's what they want to do.
Yeah, I sometimes on the show talk about the golden handcuffs of chiropractic, that if a chiropractor is not at the bench adjusting, they don't have a future and they don't have an income. So I think it's really important that people pay attention to what you just said. Make your money work for you and make it fun and easier and not as stressful. And I think there's a lot of people out there that are looking to money markets and they're looking to what do I do? How do I do it? And they honestly, people just need good guidance and they need somebody that they can trust to help them.
Right. And with passive investing, there's three big things. There's cash flow. So they're getting cash flow along the way. So, we all know that there's ups and downs in practices. So this can help with that too, if they need that, or if they just want to, put that into that cash flow into something else, or just take vacations. There's generational wealth and their wealth building, and then there's tax advantages as well. So a lot of good things with investing in real estate.
Talk to us about, because this is something I'm curious about. What are the tax advantages today in 2025 that people might want to be aware of?
So tax advantages, especially like with us, we'll do on our properties what's called a cost segregation study, where you can take depreciation. So like a paper loss, to help benefit, if you have any tax liabilities to kind of help offset that. So a cost segregation study will accelerate the depreciation. So it's accelerated depreciation. So I'll give you an example. One of the properties that we did a cost segregation study last fall. Those people, the investors, got about a 40% deduction on their taxes, like a bonus depreciation. And then this year, it'll be more like around, I think, 30%. But the laws are hopefully changing. I think Trump is going to change that, and hopefully it'll go back to like 100%, but we're not sure what's going on with that yet, as far as I've heard.
Well, I just think it's interesting because that's a lot of stuff I don't know about. I don't spend my time and interest learning about tax depreciation and valuation of property and how to do it this way. So I think it is very valuable that people could have access to you.
Yeah. And I'm not an accountant. So, I always tell people, check with your accountant, but that's basically, those are some of the advantages of owning real estate, the big tax advantages. And especially if we own our own practices, we're always looking for that, right?
Mm-hmm. Yeah. I think there's a lot to learn when it comes to diversifying our lives. I think some people get into a mortgage and they never actually buy the house. They just have a property that's not theirs, that they pay a bank to live in, and it's not an asset at that point. It's just it's more of a liability. Right. So I think when you're investing in these multi-unit properties that you're talking about, you actually don't have complete ownership of that, and it's more of an asset at that point, and it's a cash flowing asset than a liability asset. And I think that if people looked at it that way, they'd probably do what you did. They'd go buy up a place, bulldoze it over, and build something nice and add on things that they could cash flow off of on that piece of land also, which is a smart plan.
Mm-hmm. Yeah. And one of the things we do also, one of our strategies is more value add. So we'll find a property that's a little bit more rundown. It needs some improvements, some, maybe it needs new roofs or new parking lots, or the interiors need to be renovated. So there's some value add there that we can come in and do that and rehab the property and then increase the value. And also sometimes operational, maybe the rents are too low, and we can come in and we can increase the rents to market rate rents and increase the value of the property that way. So, and usually when we look for properties, always when we look for properties, when we're underwriting, we're looking for double-digit returns, a minimum of 15% per year IRR, internal rate of return. So meaning our investors will get, projected minimum 15% per year.
I mean, anytime you can put your money into something and it's giving you a positive spinoff like that and tax benefits, that's a smart path to go.
Right. Yeah. And I think, that's another thing we don't learn in chiropractic school, right? We haven't learned, we don't learn finances. We don't even learn business. So, that's one of the things that, if we can have someone else handling that for us and, do some of our own due diligence, but some of our own research, but if we can have that, like I said, more passive, then great.
Well, chiropractic is a healing art, not a business art.
Right. Yeah. So why would we learn that?
And they don't do a good job of teaching the business model to people. That's why what you were saying earlier about the students, you should go check out chiropractic seminars and find a coach. I think, finding a mentor or multiple mentors, pathways to people that have done it before you, and building relationships with people. And I do think that that's the one thing about building a practice that, we didn't discuss, is the best way to do that is build great relationships with people and ask for referrals and learn how to grassroots connect with your community. And I think that you talking about doing screenings even 27 years into the game, like, it is vitally important for you to go out there and to talk to people and tell people what you do and why you do it and how you can help them. And that's so valuable to people looking for that solution, which they don't know is called chiropractic.
Right. Early on, when I was early on in practice, I had gone to a conference, a seminar, and actually Total Solutions. I'm sure many people have heard of that with CLA, but one of the speakers was talking about someone they saw in a grocery store, a woman, a mom, and she was looking for some sort of medication because her child had an ear infection. I don't know if he had overheard her talking to someone at the store or whatever. And he thought to himself, I want to go up to her. I want to go up to this woman and tell her about chiropractic, because this could really change this child's life and this mom's life, right? So his whole thing was, I need to just get out of the way and remember it's not about me. And that has always stuck with me. It's not about me, right? So whether that applies to, whatever in your life, chiropractic, or right now live real estate, helping tenants, it's not about me. It's about helping other people, or helping our investors, helping our patients, whatever it might be. But, getting out of our own way. And like you said, I'm still doing screenings because these people need us. They need to know that there's another option for them.
Well, I think the other missing link in that statement that you made is you have to have the self-confidence and the self-esteem to get out of your own way and to go and do that thing and not live in fear. And right. I think that's the big pathway for people is, go do the right thing, but get the confidence and the self-esteem to do it over and over and over and over again. And not just making it that one time where you got the courage to go talk to the mom in the grocery store. Like you should be talking to the barista and the person that does your dry cleaning and the person that fixes your car, like the person that changes your oil, like the person that checks you out at the grocery store, the flight attendant, the Uber driver, the bank teller. Like everybody should know the story of chiropractic that's in your ecosystem.
Right. Absolutely.
Tell me a miracle story, something you've seen over the course of your career, something that might inspire listeners.
There's so many, right? Over 27 years, but there is one story that stands out. I always think of when someone asks me a miracle story, I think of this. We had a child in our practice and I believe he was around 12. This was many years ago. And he was diagnosed with ADHD. So on all the medications for it, the whole gamut. And mom came into her office hoping that we could help her son. And so started adjusting him. And after his first re-exam, he was doing much better after his first re-exam. She told me that they took him off all of his medications and he was doing great. They started mainstreaming him in regular classes and he was doing wonderful. So, that was, to me, that was a big chiropractic miracle, the power of chiropractic helping this child.
Well, I think in the heart of the matter, nobody wants their kids to be on medication.
No.
And everybody wants the kids to be able to have normal lives. And I think that that's a really cool thing that chiropractic can correct the subluxation, allow the body to heal from above down, inside out. I close out a lot of times telling people the body needs nothing extra in it. It simply needs no interference. Once we clear the interference, the body self-heals and self-regulates. And that's all the little boy needed. He just needed an adjustment.
Right.
But many times it's the parents that need the adjustment above the atlas in order to think that chiropractic is a good thing for them and their families. So a lot of times when kids, like you said, you started out earlier as a pediatric chiropractor, when you start taking care of the kids, that's a great way to say, if it works for the kids, it might work for the adults. Mm-hmm. And building that family practice. I'm sure you've seen where you start the pediatric care and then the mom's like, well, could you check me? And then the guy is always probably the last to follow, but he's like, yeah, I've been doing this work and I have this thing with my hip or my shoulder or my neck or my knee. And the next thing you know, you got a whole family under care.
That's right. That's how it works. Exactly. It's great.
Well, I think it's really cool that we could have a conversation today about all things in your life when it revolves around chiropractic and real estate. Is there anything I didn't ask you at this juncture that you would like to share with our audience today?
I think we covered quite a bit.
Yeah.
You had me on the show. Thank you.
Yeah. And if people are curious about working with you, I would say go check out the website, ascendequitygrp.com, and learn about their investing into the real estate market. And if you guys are interested in her chiropractic services, the Chiropractic Wellness Center, it's www.kidschirowi.com. And that's Kids Chiro Wisconsin, I believe, .com. And any other links you'd like to share with people?
If you want to find me on LinkedIn, it's Dr. Kate Gress. Connect with me on, like you said, on the website if you want to schedule a call and just talk about maybe what we can do to help you invest. I'm open to setting up a call with you and just schedule there.
Well, I would love to see more people have access to you and the amazing things you're doing to help people find freedom financially and maybe find the key to their golden handcuffs to where that they can step away from practice and have some diversification to where in 30 years, they don't have to feel like they have to see 300 a week if they don't want to.
Exactly.
So I would say reach out to Dr. Kate, find her on the websites that we mentioned. We'll put them in the show notes too. And Dr. Kate, thanks for being our guest today.
Yeah, thank you for having me.
Yeah, it was a lot of fun. Your episode 741 of the Chiro Hustle Podcast. I'm going to close out like I always do, telling you guys you're just one story away. Keep hustling. I'll see you guys on the next episode. Bye for now. Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.